Welcome to our testimonial night. Thank you so much for showing up. And I'm Dr. Caroline Williams. A little bit about me. I'm a functional medicine practitioner, chiropractor. I've been practicing in Las Vegas for about 23 years. And I was introduced to this technology, LifeWave, about a year and a half ago, last March. And I've been using it with patients. I've been using it myself and have seen tremendous changes on both fronts. And tonight we get to hear from the beautiful Lori Wood about her experience with this technology. I can't wait. And Nikki, could you just go over our disclaimer?
Yes. Hi, I'm Nikki McCutchen. I am one of your co-hosts tonight, and we are so excited that you're here with us. We know that someone really cares about you to want you to know about this technology and invite you to the call tonight. Our call will be for 30 minutes, and if we have new people on the call, we're going to be talking about the X39 patch that activates this amazing peptide in our bodies. And hopefully Dr. Caroline will have enough time to answer some questions. For our medical disclaimer, Dr. Caroline is most likely not your doctor. So tonight, the information we will be sharing is for informational purposes only. If you have any medical conditions, please check with your physician or healthcare practitioner. All LifeWave patches are not intended to treat, cure, diagnose, or prevent any disease. If you are on medications or have medical conditions or are pregnant or nursing, please check with your physician first. I am so excited tonight to introduce you to my sweet friend who introduced me to the patches that I'm so very thankful for. So Lori, we would love to hear your story tonight. What made you decide to be open to the patches, and what have you noticed with using the patches, and how long have you been using the patches?
So I've been using the patches for a year, almost to the day, a year, maybe a year and 2 weeks. And initially I was open to the patches because I was using a 5-therapy PEMF mat and red light and negative ion, and I really responded to frequency. Like I could feel it in my body, and I was having issues with my hip because I'm in fitness and play tennis. And at that time I was going to a chiropractor, just doing, soft tissue stuff. And then finally I was like, this is not getting better. So I went and had an MRI, found out I'm bone on bone, torn labrum, degenerative disc disease, like bad. Like, okay, you need surgery. I'm like, nope, I'm not doing surgery. So that was my first response. I'm not going that way. So I'm doing the therapy. I'm going to my chiropractor, and I run into my friend Christina, who is my upline, which is, I believe, Caroline. You are hers. And I knew her because I teach group fitness, and so she came to my classes, and she's like, "Hey, have you heard of LifeWave?" Well, she was wearing one. I'm like, "What is that?" And she's like, "Oh yeah, I have had frozen shoulder." I knew she had frozen shoulder because she came in because I also do stretching, and she'd come into our studio and went to get stretched. And anyway, so she's like, "Try it." And so she gave me some X39, and we were in the locker room at our club, and the moment I put it on, I could just feel it all the way through my body. And this was just the X39, and immediately I was like, whoa. And then she put the the ice wave on my hip, and I was like, whoa, because I had just taught a kickboxing class, so I was in pain. I always, I'm kind of okay, and then after I teach, I'm like, I have to do all my therapies just to recover. And the pain went away. I was like, wow, that's incredible. So I was like, okay, I don't know what this is. So then it just felt the same as my mat. So that's why I was open. Normally I would have been like, okay, whatever, but I still use my mat like every single day, and my patches. Those are the only two constant things I've done in the last year, my patches and my mat. So I'm like, okay, I'm sold. That day, I wish I could remember the day. I probably should have looked, but it was a year, probably 2 weeks ago, was the day I stopped taking Adderall. Cold turkey, never even wanted to, never thought about it. Like it just, I started doing the Aeon and the NX39. And since then, I've not stopped. So my hip I'm maintaining, it's a year, and like I just went to the doctor just a few weeks ago, and he said, a surgeon, just because I sprained my ankle, and I just wanted to make sure I didn't have any bone issues to stop. And he's like, you have a 70-year-old hip. Oh my goodness, you have severe arthritis. And I said, you're fired. Nope, you don't understand how much I do every single day. Don't leave with that. Like, so right then I knew that was not the doctor for me. And of course, you tell people what I'm doing, and they're like, oh, okay, and then move on. But my goal is to create, because my option was to go to stem cell injections. So I am holding off on that. So far, I don't have to do that. I don't have to do surgery. I went to another surgeon and recently, just because I want to make sure I'm, clear to continue to do what I'm doing, and just see what he was saying and what he would say. And he was like, you're amazing. Like, I can't believe you're doing what you're doing. I mean, I teach 9 group fitness classes a week, and I teach Pilates, and I practice Pilates, and I'm able to maintain this 70-year-old hip. And I know it's from the modulation. I mean, LifeWave has helped me with inflammation. I don't have that sharp pain. Like when I started, it was like, oh, it was painful. I mean, I started walking, but I don't have any of that. It's really incredible. And I do believe that there is something about this frequency that, again, very similar to the mat. And I do both. Some people have said not to do both, but I do both. And I do X39, X49, Aeon every day. Those are my everydays. I put carnosine on my tailbone for my brain. And I believe that, and that's thanks to Pastor Ed. He gave me that advice, and I believe it helps. But because my needs are hormone, brain, and inflammation, hip. And so, Nikki, this is something new. I just got, my hormones were really off this summer because I don't think it was stress, because I was going through classical Pilates training, and my hormones were just I went and had them checked, and I have 0, like not even reserve, like none, 0. She's like, Lori, how are you even functioning? I have none. So I was like, okay, I'm open. I will try to do something. I had to, because I was like brain fog, like you couldn't believe it. It was just for a few months. So I started progesterone and some cream, and I just had them retested, and I felt great, right? I felt so good. I was like, okay, this is it. We just had a test. I got my results yesterday. Still none, but feel great. So my body didn't absorb any of them. Is that crazy? What's going on? How am I able to maintain with no hormones, no Adderall, no alcohol, no drugs, patches, exercise, and my mat are my constants. Those are my only constants that I've
I love
done
it.
last year.
Yeah. So amazing. Yes. Just, amazing story. Just for them to tell you that you have a 70-year-old hip. And obviously I know you, so I know what your daily life looks like. Like, you didn't even describe, like, this person has more energy, y'all, than you can even imagine. So it just those classes and the Pilates, it's still not enough. Like Lori's like always way up here. Like we're always trying to keep up with Lori. So that's just absolutely amazing that you are maintaining all of that. Dr. Caroline, what do you have to say? I would love to know your thoughts on, the whole, she mentioned possibly getting stem cell injections. What could she potentially expect? Like if she is trying to avoid surgery, like could this peptide potentially help do something to her hip, or influence the arthritis at all? Is that a possibility? How does it potentially, do something to the hormones over time as well? Obviously, we know she still needs help in that area, but she still has this energy, which is amazing. So she feels better, which is great. Anyway, what are your thoughts, Dr. Caroline? Tell us about it.
Yeah, I mean, Lori, your story is incredible. Just understanding, like you said, how much activity that you do every day and how much, kind of like strain and stress that you're putting on your physical body cumulatively every day. It's a testament to, how you're functioning at this point without, a lot of intervention. So that's amazing. It's interesting, because I feel like there's been similar stories from other people as well that have had situations where they've had bone on bone and they got a similar experience, similar relief, to where they were able to kind of delay the surgery. It wasn't so adamant because they weren't in excruciating pain in the same way when they started using the patches. And many times that happened pretty quickly. It's interesting how that works. It does typically take time for something like the X39 to activate the stem cells and for the stem cells to start the regeneration process. And then that just continues over months, and even potentially years. And, because the stem cells can be made into any other type of cell, that's one of the reasons that they can help multiple areas of the body. The innate intelligence is going to basically direct that as far as like what's the priority. But it's very interesting how we know that regeneration hasn't really fully gotten going or completed, and people are still seeing relief. So that's very promising and pretty amazing that can happen. I
will say that also,
yeah.
I have not, there's probably 5 days in this last year and 2 weeks that I've taken an Advil. Even with this, or any type of pain medicine, even with my sprained ankle, which is worse, by the way, than my hip. A sprained ankle, I had no idea. Like it was hard. But and I just wait until I just can't. If I have like a busy day, a lot of classes, but that's kind of incredible. Like,
Yes.
The inflammation is really, and diet is also important, but that has really surprised me because that was my goal. Is I don't want to be on Advil and to take away pain, because when I first started putting those patches on, I was in pain. Like I don't know if you've ever experienced a torn labrum, but it is excruciating. And I don't have that sharp. I couldn't sleep at night.
Yeah.
And I don't have that. I don't have that. Like it doesn't stop my every day. So sorry.
Yeah. No, that's amazing. That's amazing. I remember that reminds me of the story of the ballerina who had torn her labrum as well, and she couldn't dance anymore. And then she started using the X39 and she started getting her muscle wouldn't function anymore, right? So she started getting that activity, that function back in the glute muscle. And so she was able to eventually go back to dancing. So your story reminds me of that as well. So
well, I am actually going, I've took off of tennis for an entire year, and that's just my heart. Like it's my soul. I love it. I miss it very much. And that's why I was going to okay, well, maybe I'll go, just go have the surgery and just get it done with. But I've been feeling so good that I'm actually gonna next week go play some tennis. I feel
Oh,
so good.
amazing.
Yeah, so that
Yeah.
rest was smart, but I don't want it to stop doing
Yeah. Yeah. No,
something I love.
absolutely.
Hmm.
Yeah. No, that's great. That's amazing. You're gonna have to let us know how that goes
Yeah.
when you go back
And
to
Dr.
playing
Caroline,
tennis,
the
like how you
dancer,
feel.
she didn't have surgery on her labrum either, right? No.
No, yeah, no, she didn't. And I was just going to mention that as well. Like, let's just say somebody does have a significant injury, and let's just say the patches are able to delay surgery for a certain, period of time. If at any point in time you do end up needing surgery, or, something were to happen, the fact that you've been using this patches up to that point, in my opinion, is going to influence how you respond to the surgery.
Hmm.
It's like you prepared your body to get the best outcomes from the surgery if you ever did have to do it. You're definitely geared towards a shorter repair process and less inflammation, in my opinion. And I would say too, like Nikki, you kind of experienced that when you injured your Achilles, in my opinion, like that
Right.
contributes
Yeah,
as
for
well because you've
sure.
been
Because
using,
there was,
yeah.
I mean, there was no pain, no swelling, no bruising. I mean, like, and even after surgery, like I had no bruising. It went immediately to that yellow at the end. And that was just
Mhm.
like for a day. And
Mhm.
then it was completely gone. So, and
Yeah.
yeah, it was incredible.
Yeah. Yeah. And Lori, it's just amazing how many people that you've also shared the patches with. You've just done such an amazing job of being such an advocate for these patches. For sure. We appreciate you for letting people know and being an advocate for changing people's lives. No doubt. Like, you know,
If I don't,
obviously Nikki's here for
yeah,
that reason.
if I don't believe in it, as Nikki and Ivana know, I don't do it. I mean,
Yeah.
and if I believe in it, I have to tell everybody. I just have to.
Yeah. That's
Yeah.
amazing. You've done
So,
wonderful.
Dr. Caroline, tell us about the patch influencing our stem cells versus stem cell injections.
Yeah. So, the great thing about the patch, there's a lot of great things, right? One thing is there's nothing in the patch as far as chemicals. There's no stem cells going into your body from the patch. What it's doing is it's your body heat, your own body light is activating that patch, and it's sending a frequency into the body to produce something called GHKCU, which is a peptide. And then that is influencing the stem cell production. So you're producing your own stem cells. This technology is making that possible. And one of the great things about it is it's not invasive, so there's, and it's your own stem cells, so you don't have to worry about that. Um, the alternative between stem cell injections is, it is invasive. It's not guaranteed to work. It's not your own stem cells. The cost for a lot of people is very prohibitive. So you could spend anywhere from like $5,000 and anywhere up to $20,000 for stem cell therapy. And the patches are super affordable. Even retail, if somebody was to pay retail, it's a 30-day supply for $150. So, that's kind of a no-brainer on investing in that. And you can choose how long you want to do it or not. Um, the cumulative effect over time, you're going to get better and better and better results. It's going to affect you in many different ways over time. And as far as the studies are concerned, it's shown to not only promote healing and regeneration, but reversal of age. So age reversal is one of the big things that they've seen as well. So it's pretty amazing. Yeah. Yeah. So we're very
Okay.
grateful to have, LifeWave technology. It's interesting. I shared a product with our group that was a oral product for GHKCU, which I thought was very interesting. And, the patch helping you produce GHKCU is it's way superior to any kind of oral product that you could ever take. Obviously, mainly because an oral product, you have to digest it. You don't know how much of that's going to be absorbed. You don't really even know what's in that oral product. You can speculate, right? But as far as the bioavailability of that, it's going to be, it's not going to be 100%, obviously. So stimulating your own production is way superior, in my opinion. But I just think it's interesting. So there's more companies getting on the bandwagon now because of the research. So I'm sure we're going to see more and more of that, which is great for LifeWave, in my opinion, because it just validates what we're doing with these patches. It validates that what we're stimulating gets results, right?
Absolutely.
Yeah.
Yes, it's so amazing. Well, we just have a few minutes left. I'm wondering if anybody has any questions that you'd like to ask Dr. Caroline.
Yeah, or even Lori, Lori sharing her story. If anybody wants to ask Lori questions, that would be great too. Yes, Pastor Ed.
Hi, Laurie. Good to see you. Hey, Dr. Caroline, Nikki, it was great to see you guys. I'm working, so just gotta excuse me all the banging and stuff I had to turn off. But I wanted to say thank you, Laurie. You've been an inspiration for our organization and all the people, like Dr. Caroline says, that you share this technology with. I have a quick question. How is it that you sponsor so many people into this business? How easy it is for you?
Oh, I don't know. I don't know. I have no. I mean, all I have to say is it's just been authentic, and I haven't even done anything. I don't even feel like I've done anything. Honestly, I feel like it's just the right people, right time. Led by the Lord, open up doors. Just living and talking. I mean, if you have something that you love that works, wouldn't you want to tell everyone? Like, it's almost like, shut up, Lori. Like, this is not your audience, but I can't help it. And yeah, sometimes you can be the crazy one. Like, okay, but I know. I mean, I always lead with my mat, and my mat, it's the same frequency. Like, I mean, I know my mat's helping me, and I feel it with the patches. So when you tell everybody,
Absolutely.
but thank you for reviving this for me, because life has really taken a weird curve for me. And even though this has been my constant, and so I haven't really promoted it, I haven't really been talking about it a whole lot, but this definitely reminds me that why not share the things that will help others. So this might be a revival for me. I don't know. We'll see.
So great to hear. And she's being modest, guys. She sponsored over 30 people, okay? And she hasn't started yet. So watch out when she started.
I really haven't. That's so crazy. Thank you. Yeah.
Yeah, you've done amazing, Lori. And I would say your story's powerful. So just, I can see just sharing your story. It's just, that's what I think, no doubt, gets people interested in this and trying this. So you're doing an awesome job helping everybody. Yeah.
Thank you.
You're welcome. All right. Anybody else have any other questions tonight?
Yeah, I do. Hold on.
Yes.
Yeah. My son-in-law is coming in on Tuesday and for the week. They live in New Mexico. They have some of the patches because I had given them patches, but apparently my daughter is hawking them. So he's having some problems with his rotator cuff. and he's not sure what's happening. He's going to try to get an MRI in tomorrow before he comes out so that we know more. But what are the patches that, I mean, he has range of motion, he said, but he's in constant pain and he can't necessarily really sleep on it. So what would be the best patches for me to tell him, like, okay, I figured the X39 and the Eon, but are there any others that I could recommend? Would the X49 be a better, X39 49 a better combo, or X39 Eon a better combo?
I would say X39 Eon and Ice Wave. And
Okay.
and Anthony's on our call, or at least he was, and he had a great story a couple weeks ago about his rotator cuff and how degenerated two of the tendons were, to the point where it was recommended by his orthopedic surgeon to have a reverse shoulder replacement.
Wow.
And he got interested in the patches because when he first used the X39, or let's just say he could only, I'm telling Anthony's story here instead of Anthony, but he could only raise his arm about 15 degrees up from the ground. And then he put the X39 on right after he ordered them. He said like Saturday at 4 p.m. And then by Monday morning, he could raise his arm to 90 degrees.
Wow.
Yeah. So he has an amazing story, but I would say definitely X39, Eon, Ice Wave. That would be the combo that I would start with.
Okay. And
yeah.
would you put the Eon as well on the pain spots, or just the Ice Wave, and then the Eon basically like either belly button or behind, and vice versa with the X39?
You could do, you know how we have the 7 steps for pain.
Yeah.
A lot of times with the 7 steps for pain, you might start with that because that covers, applying the Eon, applying the Ice Wave, which one you would apply first and how you would apply them. And it just kind of goes through the steps so that you can kind of see, do you need to go, you may not need to go through all 7 steps, right? Because that involves more patches. But that's actually for any kind of pain situation, that's kind of how I would probably start it. Is using the 7 steps for pain, and just see how far you need to go for him to get relief. And sometimes, with the Ice Wave, he should get relief pretty quickly, right? I know Anthony knew nothing about the Ice Wave. He only used the X39, and his relief came about 2 days or like a day later. Which is actually amazing because that's kind of atypical. Well, I don't know, at least from my experience, for it to happen that fast. But there are people that it has. So I would definitely start with that 7 steps for pain. Yeah. Do you have that, or do you need us to send it?
I'm not sure. Yeah, I have the 7 steps thing. I do. Not sure if I have enough Ice Wave, but I'll check because I need to check in my box. I know I have enough Eon and X39 to get them started with, and then they could possibly order some more themselves if they can afford it at the moment. But that would be something that.
And Ivana, if you need me to come over and do the Ice Wave, I'm happy to help you, or the 7 steps to pain. Just let me know. I'll come over and help you do all that. Yeah.
Okay. Thanks. Appreciate it.
That's awesome.
Absolutely.
That's awesome, Nikki, because I was going to mention, like, hey, reach out to us and let us know if you're having challenges, and then we can like navigate it, right? We can troubleshoot it. But that would be great if you could help her. Yeah.
Okay.
That'd be awesome.
Awesome. Great.
Yeah.
Thanks.
Yeah.
I know we're over time, but it looks like Sandy might have a question.
Yeah.
Hi, this is my daughter, Stacy, and I have a good friend, Margaret Paulson, joined us tonight. Stacy has a question for you, Dr. Caroline.
Yeah.
I'm a dancer, and I've had like chronic hip pain in my left hip, my right hip at times, kind of like within the lower part of my back, or the piriformis or the hip point. I've tried the Ice Wave a little bit, but I find it really hard to like find the point of like it relieving anything or like seeing any difference. I know I've like done the Eon and I've the X39, and I can tell a difference in that sometimes. But with the like
The ice wave.
I've had a hard time like seeing where to
Apply it.
how to place it.
Mhm.
Yeah.
Have you tried, so I had a patient not long ago, and she had an issue with her SI joint. And what I ended up doing was, I put the brown patch on the point of pain. In her situation, it was in the groin, so I had to put it kind of right there. And then I put the white patch through the joint. And kind of that's how I did it. I went through the joint. Sometimes, like they'll have you put the brown patch, and then they'll have you do it like a clock-like pattern,
Yeah,
right?
that was
So
what
that
wasn't like seeming to work as much.
Yeah. So sometimes I'll go through the joint. So I'll put the brown patch on the point, like more the side that you're having the pain. So if it's more in the back, it's more that side, that's where you put the brown, and then you put the white in the front, like you're going through the body. I would try that because
Oh,
I've
okay.
gotten I've gotten some results with that. And then what you could do is couple, like you can patch this, you can stack the patches. Have you tried that? Like stacking the patches? So
Done it
you
on
could
my
do,
neck with the like 39 and the Eon before.
oh, right. Okay. Yeah. So you could also do that with the ice wave. So if you
Okay.
put the ice wave and you go through the joint, like brown on the back, white on the front of the body, you could then put the Eon on top of the brown patch as well. So you can stack it with the ice wave, try that. And see how that works for you.
Yeah.
I think that's
like kind of going through that. Would that be the same with like if I've had like shoulder pain and I can't get the
clockwise pattern?
Okay.
Right. Yeah, I would try going through the joint. Hey, Lori, since you've had experience with that, what do you suggest?
Well, I always use X09, X49, Aeon every day.
Okay.
Sometimes like for my knee, sometimes I'll have some, if you're just because of the hip, there might be some compromised movement. I will put carnosine, Aeon, that's the only one, and then maybe ice wave around the knee. So I don't know. I really like carnosine. I think it's a game changer for my brain, and I can tell a difference. And I'm also congruent with the Aeon on the knee. It's almost like it's like I explain like a force of energy that like surrounds the joint, whatever joint it is. So I don't know how you would do that with the hip. I mean, sometimes I'll put an Aeon right on my hip, just if I'm feeling a lot of pain. And sometimes like, up and, layer it up and down that way. But I just love the feeling of energy in my body. I don't know, it just takes pain away, and maybe it just tricks my brain. I don't know, but the more patches, the better. And I might end up having 10, but I do muscle testing. In my own way of doing muscle testing in the morning, we're like, okay, what's going on with my body? What do I need? So I check in every day. So sometimes I might, have 10 patches. Sometimes I just have 3, but I always have 3. But experimenting, not being afraid to experiment, and find what works for you.
Yeah, and
awesome.
Sandy, shoot me a text, because Stacy, if you guys want me to come over, I can come over and try to help you too. So yeah, Sandy, just text me. I'm happy to help you, Stacy. So
yeah,
That'd be great, because Stacy's just here for a short time. Thank you
Yeah.
so much. This
yeah,
has
I'd
been
love to
really
meet her
wonderful.
too. So yes, for sure.
yeah. Thank you. That's really helpful. I can't remember who you were talking about, like doing Pilates and a lot of stuff like that's. I'm not in Pilates, but dance, and I've had a shorter, like not as busy season, and I've also felt my body like have less mobility than it used to. I'm not super old, but I'm like in my 30s and wanting to maintain like.
Well, I wish you lived here. We would really do some stuff.
Yes. Where are you?
She's
I'm
right
in
here.
Tulsa.
Also.
Yeah,
Oh, okay. Okay. Yeah. Well, I can connect to you through my mom then.
Yes. Okay.
I would
Yeah.
love to come take a Pilates class or something.
Yes. Love it. That's what we all need.
She-
And
she's-
patches.
She's doing good for just having flown in from France with the jet lag. So
Woo!
thanks for
Yeah.
taking the
That's
question.
amazing.
Yeah.
Yes.
Yeah. thanks
Stacy, you
for
can
being
come
on
with
here.
me. You can use one of my guest passes. We'll go to Lori's class.
Oh, okay. Yeah, I would love that.
And thank
Well,
you,
remember-
Margaret, for taking the time to come. Really appreciate you showing up.
Yes.
Hi, Margaret.
I gotta go, guys. I have a couple
Yes.
more things to do, but I guess next week we don't have a meeting since it's Thanksgiving.
Yeah, probably. Yeah, we'll cancel next week because it's Thanksgiving. Yes. Yes.
Okay.
And we'll resume the week after.
All
The
right.
following week. Yes.
Well,
Yeah.
everyone has a wonderful Thanksgiving then, and don't eat too
thanks,
much.
Ilana.
Yes.
And
Yeah.
Thank
have
you
a
all so
fun
much
time.
for being here tonight. Yes.
You're
Yeah.
welcome. Thank you,
Please
guys.
get back to
See
the
you.
person who invited you if you need help. And if they need to connect to us, they can as well. They know we're always available. So everyone be blessed.
Thank you.
Thank
you
you,
so much.
Lori.
Thanks,
Bye.
Lori.
Thank you. Good night.
Good
Good night,
night.
you guys.